listening to Rated RX. Your dose for the day.
Picture two kids in the same classroom. One is loud, restless, always moving. Everyone notices. He gets evaluated. The other is quiet. She drifts off. She forgets assignments. She feels anxious. She works hard to look fine. She gets called shy, sensitive, or unmotivated. And nobody asks about ADHD. Today you'll learn how ADHD often looks different in boys and girls, why girls get missed, what to do, what that does to school and mental health, and then we'll do a quick self-score activity using the DSM-5 TR style symptom checklist in plain language. For those unaware, the DSM-5 is a manual for mental health professionals to use to define and standardize criteria for diagnosing mental disorders, including ADHD. Quick favor, if you like healthcare stories and plain language education, hit like, hit subscribe, and share this with someone who needs it. Rated RX is an affiliate with the Pharmacy Podcast Network. Please check them out for more amazing healthcare-related content. I'm Robbie. I got Sam. I got Xavier. We are pharmacists.
Hey everyone, what's up?
This is Rated RX's Trending Health Questions Breakdown. We take questions people are searching online and give you an accurate explanation. Quick reminder, this episode is education only. It's not a diagnosis and it's not medical advice. If something here hits close to home for you or your child, please talk with a licensed clinician. Here's the simplest way to frame it. Boys with ADHD often get noticed because their symptoms tend to be external. You can see them. Girls with ADHD often get missed because their symptoms tend to be internal. They feel it.
So the system reacts to disruption, not to distress.
Yeah. And if you're not causing problems for others, adults just assume you're fine.
And that's where a lot of girls actually get missed. A lot of boys present with signs that stand out fast. They might have high energy, impulsivity, blurting things out, interrupting, risk-taking. Sometimes it shows up as aggressiveness or defiance. That does not mean the child is bad. It just means that regulation for them is much harder.
And I'm sure, as everyone knows, teachers don't ignore those things. Parents can't ignore it.
Right. It becomes a daily issue. Referrals happen earlier for boys and for girls, much later. Now here's where it gets really tricky. Girls often show a different pattern when it comes to ADHD. They might have inattention, disorganization, daydreaming, quiet drifting. They also show anxiety or depression symptoms much more often, or emotional overload. Sometimes the first thing adults notice is stress.
Yeah, girls are pretty good at masking their symptoms. They do a good job at compensating. They over-prepare, they people-please sometimes. They stay quiet. They work twice as hard to look good, but then later they may crash later in the day.
And so those struggles stay hidden.
Exactly. And people label it as a personality or mood instead of ADHD. So let's talk about diagnostic bias and referral bias. A lot of people still picture ADHD as hyperactivity. That stereotype pushes the system towards spotting boys first. Referral patterns matter a lot too. Loud behaviors get attention. Quiet symptoms get delayed attention.
And the symptoms, they tend to overlap with other things such as anxiety, or sleep issues, trauma, learning issues. So it can be hard to figure out.
Yeah, there is a lot of overlap, and that's why ADHD is often missed or misread when it comes to girls. In clinical settings, ADHD is diagnosed more often than boys, commonly about 2 to 3 times more than for every girl that's diagnosed. But community studies show a smaller gap. That supports the idea that girls are under-recognized.
So it makes sense that clinical numbers are reflected by who gets referred.
Who gets noticed changes who gets counted. ADHD rarely shows up alone. Boys more often have external behavior conditions like being oppositional or conduct problems. Girls more often have internal conditions like anxiety, depression, as Xavier mentioned. Some girls get treated for anxiety or depression first before the ADHD even gets recognized later.
So they basically treat the smoke, but they miss the fire.
Exactly. They're treating the symptoms, but not the cause of what's going on. Boys often get flagged for behavioral or academics. Girls often take hits in the social and emotional lanes. Friendship issues, social isolation, emotionally overwhelmed, low self-esteem, perfectionism.
You can still have good grades, seek that perfectionism, and still be struggling.
Yeah, some kids do well to hold it together during school, but they fall apart at home. I mean, the after school crash can be pretty real.
It is, yeah. Delayed recognition can lead to bigger problems over time. More academic underachievement, more emotional distress, more social impairment.
So it sounds like we need to try to work on detecting these a little earlier to change that story.
Exactly. If you're a parent or clinician listening, here's what helps. Don't rely only on hyperactivity when you evaluate girls. Use multiple informants, parent input, teacher input, and when appropriate, the child's own report. Ask about coping strategies, over-preparing, perfectionism, avoidance, exhaustion after school, screen for anxiety, depression, emotional regulation problems, especially in girls, and ask about function in more than one setting, home and school, or work and home. Now, treatment. We're not going to go too deep in that today. Maybe we'll do another episode on this, but let's just quickly go over the basics since we're pharmacists.
The
We're
Patreon.
talking about the meds here, right? Many ADHD medications work by supporting brain signaling that involves dopamine and norepinephrine. These are neurotransmitters that tie into alertness, attention, motivation, and impulse control. There are also non-medication approaches like behavioral therapies, school accommodations, coaching, and routines. Often, it's a mix.
I know a lot of parents have a hard time trying to medicate their kids. It can just be scary for them, not wanting to do that or numb them down. You can know why it is valid to be hesitant as a parent.
Yeah, which is totally understandable. The best move is a real conversation with the child's clinician about the benefits, risks, and what you will monitor. Side effects can definitely happen. Appetite suppression is one, and for a growing child, poor appetite can become a problem if it leads to inadequate nutrition and can potentially interfere with healthy growth. Sleep disturbance can also happen, which might lead to even more problems in school and academics. Some kids feel more anxious on certain meds, especially if they already have anxiety. And while it is rare, there can be cardiac effects. That risk is mainly a concern in people with pre-existing heart conditions, which is exactly why clinicians ask about personal and family cardiac history. But there's another side that people don't talk about when it comes to getting treatment for ADHD: prescriber hesitancy. Some clinicians feel very cautious about prescribing meds because many stimulant medications that are used for ADHD are controlled substances and highly regulated. But a major reason that clinicians actually report is a lack of confidence in training. Some clinicians report they don't feel fully trained to diagnose ADHD or manage medications adjustments, especially when symptoms overlap with other conditions.
So basically what you're saying is that the clinician kind of hesitates. That makes the family hesitate about medication, and then the kid keeps struggling and having issues.
Exactly, which is why you want a thorough evaluation and a clear plan. All right, we're going to do the DSM-5 TR ADHD Diagnostic Criteria Questionnaire. Now, quick disclosure here. Before we start, I am not reading it word for word as it is defined in the book. I am simplifying the language so it works better on the show, and more because this is for educational purposes and self-reflection, This is not a diagnosis. I cannot emphasize that enough. A real diagnosis requires a clinician who's trained at diagnosing, history, and other rule outs. We discussed a lot of stuff like anxiety, things like that. So this is not something you should be diagnosing yourself with. In your notes, make 2 sections: inattention and hyperactivity impulsivity. ADHD can show up in 3 ways: mostly inattention, mostly hyperactivity and impulsivity, or both together. For each item, if this resonates with you, mark yes, but it has to have been present within or for at least 6 months. Now, if you're 17 or older, the threshold is 5 or more symptoms in this category. If you're a child, the threshold is 6 or more symptoms in this category. This is the inattention questionnaire. Number 1, you miss details or make careless mistakes because your focus slips. Number 2, you struggle to sustain attention during tasks, conversations, lectures, or reading. Number 3, people think you're not listening even when they're speaking directly to you. You guys ever hear that from your wives? You don't. Number 4, you don't fall. Keep going. Number four, you don't follow through and you leave tasks unfinished because you get pulled off track. Number 5, you struggle to organize tasks or manage steps and time. Number 6, you avoid or strongly delay tasks that require sustained mental effort. Number 7, you lose things you need, like keys, phone, wallet, paperwork, glasses. Number 8, you get distracted easily by outside activity or unrelated thoughts. And number 9, you forgot day-to-day responsibilities, errands, calls, bills, appointments. All right, count your yes answers. That's your inattention score out of 9.
I'll say mine's below 5.
Okay, all right.
Mine's above 5.
Yours is above 5. Okay. All right, this is part 2, hyperactivity and impulsivity. Again, 9 questions. Number 1, you fidget, tap, squirm, or feel physically restless. Number 2, you struggle to stay seated when you're expected to stay seated. Number 3, you feel restless in situations where being still makes sense. Number 4, you struggle to do leisure activities quietly because your body or brain stays on. Number 5, people describe you as always on the go, like you have a motor. Number 6, you talk excessively or talk fast when you try not to. I'm guilty of that. Number 7, you blurt things out or answer before the question is finished. Number 8, you struggle to wait your turn, like in lines or group discussions. And number 9, you interrupt or intrude on others, like jumping into conversations or activities. We all got a coworker like that. All right, count your yeses. That is your hyperactivity impulsivity score out of 9. Care to share your answers?
I got a 4.
Okay.
Not quite there.
I got a 1, I believe. So
Okay.
low on the hyperactivity. I think I was like a 2 on the inattention, so pretty low on them.
Mr. Focused over here. Wow.
No ADHD for you. Meanwhile, I'm borderline.
I mean, on the second one, you're borderline, but well, if you scored high, for those listening, that does not mean you have ADHD. It just means you got some symptoms worth discussing with a clinician. Now, bringing it back to the main message here, Girls often get missed because their symptoms look like quiet inattention plus anxiety or depression, and because they mask. So if you only look for loud hyperactivity, you miss the quieter kid who is drowning. If this episode helped you, please do 3 things. Like and subscribe. If you care to, comment your 2 scores out of 9. Share this episode with a parent, teacher, or friend who needs it. All right, guys, we'll see you next time. Thanks for tuning in.
Rated RX, your